My name is Ed Fogden, consultant gastroenterologist and co-chief clinical information officer at Sandwell and West Birmingham NHS Trust. So Midland Metropolitan University Hospital has replaced two ageing hospitals, Sandwell General Hospital and Birmingham City Hospital. So for me, Wavenet solution means that we have a stable telecoms platform. The key thing for clinicians was to be able to maintain the provision of service without any interruptions. For example, our 2222 emergency medical response teams are reliant on having a functioning 24-hour, 365 service from Telecoms.
I'm Mark Taylor, I'm the Interim Director for IT and Digital, and I work for the Sandwell and West Birmingham NHS Trust. The infrastructure challenges that we needed the system to support, so we had our old legacy Analogue systems and we needed to move to a new, more efficient IP-based solution. We also needed to ensure that any solution that we did have had security and reliability designed into the solution. When we opened Midland Met, when we chose that date, we had to open. So we had to ensure that any system that we did put in place was not only installed prior to moving in, but was also tested to ensure that any of their failover devices, they worked.
Having new infrastructure in the new hospital has allowed us to maintain service without any obvious change to day-to-day practice. Ideally, we wouldn't want our doctors, nurses and associated healthcare professionals to notice any change, and it has been a seamless transition across. There's an extraordinary amount of work going on to ensure that small snags and small issues were fixed very quickly during that initial move-in period, and I'd like to think that clinicians didn't notice a huge change in the infrastructure on the way through to the new hospital.
My name is Jonathan Lees, I'm the Director of Healthcare at Wavenet. This project was a live transfer of patients. Normally you have a brand new site, you put all the kit in, all the licenses, and everybody just gradually goes in and sets up. This was very unusual to have a good project to work on. I was happy to kind of get involved as well.
So the benefits of working with Wavenet are they very much seek to understand what the problem is that you're trying to solve. Often they were thinking beyond what we were thinking. So they were able to, often at times, once they understood what it is the journey we was trying to take, they could then suggest solutions along the way as well. During our project at Wavenet, we're very agile and very responsive. And when we needed them to be able to come forward with some additional resource to support us in certain areas, they were able to provide that resource.
We have about 800 plus healthcare organisations, and I'm really proud to lead that team where we don't just have them all in one sector. So we have customers ranging from GP surgeries in primary care all the way through secondary care to urgent care and working with NHS England as well. So we cover a large area of the healthcare organisation. We were really proud to work with Sandwell West Birmingham NHS Trust on this. Being such a large hospital, 736 beds, it proves that Wavenet can really deliver. It was nice to have everybody involved in this and make this a very successful project.